We're going to talk about pelvic floor relaxation techniques. So today I'm going to show you one that's focusing on relaxing the pelvic floor muscles. So think of your pelvis as a bowl, and those pelvic floor muscles kind of sit like a hammock at the bottom of your pelvis. So they help prevent incontinence, so they are what stops the flow of urine, but they also need to relax to allow the flow of urine when you're going to the restroom, as well as for bowel movement. So those muscles need to relax as much as they need to tighten to prevent incontinence, and as well as they are support for our internal organs. So everything that sits up here, those muscles take on all of that pressure. And so they are a very important part of our core because they are part of that whole pressure system. But sometimes what happens is those muscles get tight, and they can be weak and tight, or they can be mainly tight or mainly weak, lots of different combinations there. But when they are tight, it's hard to feel your breath go down into the pelvic floor. But when we breathe, we want 360 degrees of expansion. We also want that breath to go down into the pelvic floor to allow those muscles to relax. So what's important is that we be able to relax those muscles, allow our breath to get down into the pelvic floor to lengthen those muscles. So in order for a muscle to be able to be properly strengthened, it has to be able to lengthen also. And that can sometimes be the missing piece if you're experiencing leaking of urine with whether it be coughing, sneezing, jumping, more impact type exercises. We need to make sure that we can first relax the pelvic floor. So this is a good technique that I'm going to show you. I have these little bolsters. You can also use towels or pillows at home. But the big thing here is with this top one, you want it positioned so that your ribs don't flare up. We need to keep your ribs down. And then what I like about having one on each side here is it allows your knees to relax. So you're opening up at the inner thighs there, and that's going to help you feel those muscles down in the pelvic floor relax. So all you're focusing on here is doing that deep diaphragmatic breathing, focusing on letting your breath go down into the pelvic floor as you inhale. You can think of your pelvic floor muscles as a blossoming flower, so they should release and relax as they open up. So I'm just going to do a couple deep breaths here. So this is a good exercise to do both in the early postpartum period to make sure that you're feeling those pelvic floor muscles relax, as well as if you experience pelvic floor tightness, any symptoms of pelvic pain, as well as in the prenatal period to help as your pregnancy progresses, make sure that you're able to relax those muscles. It's very important as you prepare for birth. So give that a try. Focus on breathing. Spend a few minutes there just focusing on relaxing and focusing on your breath.